Okay, we've opened the room. We're going to give folks a few moments to sign on and join us. Then I will do the introduction and then turn the floor over to our host today, Mr. Paul. So we'll just give folks a few minutes. For those of you just signing on, we're giving everybody a moment to get connected, and then we will start with our keynote speaker. Okay. We'll get started. Hello, and thank you for joining the first annual New Jersey Youth Transitions Conference. My name is April DePietro. I'm the Community Resource Director for the Camden County Care Management Organization. I will be your host today for this session, which is the closing keynote. I am joined today by our panelists, Mr. Paul Aronson, who will be your presenter today. A couple of housekeeping items before we get started. In this format, all participants are muted by default. If you would like to communicate with myself or the panelist, please use the Q&A feature located at the bottom of your screen. Questions will be answered at the conclusion of the presentation. A recording of these presentations will be made available within the next few days on our website, which is www.njyouthtransition.life. This session is also being closed captioned. In order to activate the closed captioning features, please click on the live transcript button on the bottom of your screen window and click Show Subtitles. If you need technology support at any point in time during the conference, you can access our live tech support Zoom room sponsored by Richard West with ATAC. The Zoom room link is available on our website. Please be patient as there may be many people seeking help at the same time. If you are having technology difficulties now, please first check your sound and try signing out and signing back in to this session before visiting the tech support Zoom room. Oftentimes this fixes the issue. Please note that we will have never mind, this is the last one, so we don't have to say that. I will now turn it over to our presenter, Mr. Paul Aronson. Thank you very much for being our keynote, and the floor is yours, sir.
Great, thank you. Good afternoon, everyone. It's great to be here. Before I start, I do want to thank everyone involved in this program, because I think this has been such an important program. I'm sure very useful for folks. I'm glad it's the first annual, so I'm looking forward to the second one too. But I just wanted to thank everybody involved, the organizers, of course, the participants, the panelists, as well as all of you sort of tuning in and participating with your questions and just being part of the conversation. And I particularly want to thank one of the keynote address presenters earlier, Julia Brugel. I'm sorry if I pronounced her name wrong. I was so moved by her presentation, and I thought it was so important. And I would urge anyone who didn't have an opportunity to see it to check out the recording earlier. Her story was personal, compelling, powerful. I mean, it was so important, I think, for other family members, other parents, particularly, to hear. So I'm glad to be here today. My name is Paul Aronson, and I have one of the longest titles in state government. I'm New Jersey's Ombudsman for individuals with intellectual or developmental disabilities and their families. And what I thought I would do is, just because I'm not sure who's in the audience today, just tell you a little bit about our office to make sure everybody sort of knows what we do, why we do it, and also how we do it. Tell you a little bit about those of us who work in the office. There's two of us. And then sort of talk to you about transitions and what we hear from families all the time about this very important subject. and a couple of our recommendations going forward. And then hopefully there'll not only be time for questions and answers, but we'll be able to get the Q&A function going and be able to take some of your questions. And I will say at the outset, for anyone on this, please, if you have a question or concern, anything after this program, feel free to reach out to me directly. You can get my email address from the organizers. Maybe I'll put it in the chat later if I can figure out how to do that. But we're here all the time, myself and Christine Bachter in my office, to help with any issue that we can possibly help you with. So our office was created. It's relatively unique. I don't know if there's another one like it in the country. It was created by the New Jersey State Legislature in December of 2017. It was signed into law in January of 2018 by Governor Christie, and Governor Murphy appointed me as the first ombudsman in April of 2018. So the office has been up and running about 3.5 years. And it's an office that was born out of the recognition by folks in the legislature, particularly, that while there are a lot of resources in New Jersey, a lot of good resources, the system is just overwhelming at times and can be so complex and so confusing for the individuals and families that depend on it, that they wanted to set up an office to serve as a resource for individuals of all ages, of all types of intellectual and developmental disabilities and their families, recognizing that due to the lifelong nature of the disabilities, that there's a constant need for clarity and information and programs and resources and supports and services throughout the life. And so we need to sort of set up an office and sort of make it a little easier, if you will, make the system a little more user-friendly. So they created our office, and the legislation that created the office sort of established some responsibilities, but we sort of grouped them into 3 buckets, if you will. First, we serve as a resource, again, for individuals and families on all issues, big issues, small issues. We try to help people on issues that impact their lives, but also sort of engage with them and look to see if we can help, sort of fix the system more generally. And 2, that leads to the second thing is we work very closely with individuals and families to look for ways to improve the system, to make it more accessible, more user-friendly, easier for families to navigate. And third, and very importantly, and cutting across all we do, we really try to work to help make sure that the voice of individuals and the voice of families is heard in a meaningful way on issues that directly impact them, but also in the larger policy discussions. We try to help create platforms and help families sort of, not only find their voice, but if you will, elevate their voice and connect with legislators, connect with reporters, connect with government officials. Because there's no more important voice than that of the actual individuals and the families, and something that we're reminded of on a daily basis. So there's, again, 2 of us in the office, myself and Christine, and we work again with individuals, from birth through the lifespan, and full range of issues. The big 3 of housing, education, and employment, but also access to medical care, access to supports and services, working with the Division on Developmental Disabilities for adults, or working with the Children's System of Care for children, working with the Department of Education, Department of Transportation. I mean, our reach is sort of throughout the government. And that in part lends itself to how our office was structured. In the legislation that created it, they made us technically, we're in but not of the Treasury Department, which means we get our paychecks and our emails through the Treasury Department, and that's pretty much it. But what that does, though, it allows us to have system-wide perspective, which is critically important. We're not housed in just the Department of Human Services or just the Department of Children and Families. We work very closely with our colleagues there, but because the issues that affect folks with disabilities, like issues that affect everyone else, don't reside just in one department, it was important to give this office system-wide perspective. And so that allows us on a daily basis to work with colleagues throughout various departments in Trenton, as well as on the county level, local level, and throughout the disability community more generally. again, so there's two of us in our office. We find more often than not, we've sort of evolved as the office has sort of, we've sort of grown as we've sort of, over the last 3.5 years and sort of developed, again, based in part on the legislation that created us, but also just sort of on finding the need, if you will. And we find more often than not, we're troubleshooters. We work with individuals on families on a daily basis, literally 7 days a week, through email, through phone calls, through now virtual meetings, but more often than not, when we can, actually in-person meetings in the family's home, in their school, in their workplace. And we help them just, get through, little issues, big issues, a bunch of issues. We play that troubleshooting role and really try to connect them with the resources on whatever level of government it's necessary, or sometimes in the nonprofit community too. Myself and Christine, my colleague in the office, we both came to our work, our positions with both professional and personal experience with disability. In my case, I used to be mayor of my town in Ridgewood and Bergen County. I did a lot of work with the families in my town on disability issues. I'm on the Bergen County Disability Advisory Board. I've served in different disability organizations, including the Center for Independent Living up in Bergen in Hudson County, Heightened Independence and Progress. But like a lot of folks that work in this space, I came to it because I have disability in my family. It's very personal for me. In my case, I'm a sibling. All three of my siblings have had a mix of disabilities and healthcare challenges. And so, learning about disability, becoming passionate about disability has been a lifelong, journey for myself, particularly in the context of my older sister, Patty, who had developmental disabilities. And that meant when she was a child, she had learning disabilities and cognitive challenges, as well as behavioral challenges. Physically, she was a dynamo, played softball, loved to dance. We used to play all the time together. But in her 20s, her disability started to express itself physically, and slowly but surely, Patty lost her physical ability to walk and to care for herself. She became quadriplegic, required a feeding tube, trach, effectively lost the ability to verbally communicate. And so through being her brother, I learned so much about disability and became so passionate. And watching my mom as her primary caregiver, first when we were children, but particularly actually as adults, as Patty's needs grew, really learning about the challenges faced by families and individuals with disabilities. And similarly, my colleague, Christine Bachter, is also a family member. In her case, she's a mother of a young man with autism. And so she, for her, it's been very personal. And I tell you that, and I often share that with audiences because it's important to realize that Governor Murphy, appointed me primarily, and then we brought on Christine because we wanted folks in this office that had that lived experience, if you will, that understood in a very personal way what it means to have disability or disability in your family, and that allows us to connect with folks a lot better. And the conversations we have with families is very personal, and I think that really helps not only us do our job, but I think it helps the system more generally, because I think it really adds a component that I won't say that's been missing, but not there enough, because of just sort of the way offices are structured and the way processes are structured. Sometimes the individual and the family sort of gets pushed aside. And so we really make it a point in our office to sort of connect in a meaningful way and on a regular basis with individuals and families. So by the very nature of our office, more often not, people come to us when there's a problem. And that's how it should be. We don't get all the success stories. People don't come to us when things are going well. But we do get people when they're oftentimes in crisis and not doing well and not being treated well, or they feel like they're not being treated well by the system, or their loved one is not. And so as we often say, we see the system of care in New Jersey as really a tale of two systems. On the one hand, there are tremendous resources, great people working throughout the system, in government, outside of government. We've got a lot of financial resources, a lot of programs and supports and services for children as well as adults. but there's also a lot of gaps, and there's a lot of people struggling. And these are the people that Christine and I usually work with on a day-to-day basis, again, on the full range of issues. But oftentimes we spend much of our day talking with folks, working with folks on issues related to the transition. And again, I'm so glad that and grateful that we're having this 2-day conference about transitions, because it really is one of the only issues that all individuals and families with developmental disabilities have in common. There's so much diversity within our community, understandably so. But every child with an with an intellectual developmental disability becomes an adult with an intellectual developmental disability. So that transition is common to everybody. And despite how common it is and how important it is, it's not always what it should be. Again, sort of like our tale of two systems, there are some folks for which the transition is relatively smooth, relatively painless. There are resources, from their school district, or maybe through the Department of Children and Families, or through the family and through other support mechanisms, that transition might really work well. Department of Labor, that might work well. But for a lot of folks, it's not working well. And again, these are the folks we deal with. Even when I was a mayor back in Ridgewood, I remember talking to families about the cliff, about this feeling that they were about to fall off a cliff, when their children age out of the system at 21. And that's because, up to 21, a lot of the sports and services, are mandated by both federal and state law. They're an entitlement. Once you become 21, it's no longer an entitlement, as you all probably know. And so it becomes that much more challenging and that much more difficult. And so having that support mechanism, having those resources, available to families during this very precarious, very difficult, very stressful time is so important. And that just doesn't happen, unfortunately, across the board. You've heard some great presentations throughout the last 2 days, from a lot of my colleagues in different parts of government and elsewhere. And they're doing such important work, really helping people through that transition. But we all know, that it's not equal across the board. Some school districts do it better than others. Some folks have, access to resources and others don't. And so one of the things that we deal with in our office is not only looking at this as a very real and potential and dangerous cliff for a lot of families, but we feel that a lot of families actually fall off what we say the grid, that they completely fall off out of the system. And I'll explain what I mean by that in a minute. But I think it's important to level set when we talk about transitions. And I had the opportunity to listen to some of the presentations today. We're not just talking about transitioning from, let's say, the school system and the children's system of care into the Division on Developmental Disabilities, which is an extremely important transition for many folks. But as you heard also, it's also transitioning in employment and working with the Division of Vocational Rehabilitation Services. But it's also even beyond that. It's transitioning in housing. It's transitioning in healthcare, going from a pediatrician to now an adult doctor, an adult dentist who doesn't know your child and who doesn't understand perhaps developmental disabilities. It's dealing with legal status issues like guardianship and supportive decision-making and power of attorney. It's dealing with Medicaid and Social Security. There are so many issues and things and challenges that families have to face during this transition. It can just be overwhelming. And what I was alluding to a minute ago is, I have a feeling, and we suspect this in our office, that folks are not only struggling through this transition and with these issues, but a lot of them are just falling off the grid because of cultural reasons, because of language barriers, because of socioeconomic reasons. That are many people, we believe, that are aging out of 21 don't end up in a day program, don't end up at a job, don't end up at a college program. They end up on the couch in the living room with no bus picking them up, no modes of transportation, no program, no support service in place. And I say that for two reasons. One is, we've made a real push in our office for the 3.5 years of trying to reach anybody and everybody who needs our services and supports in New Jersey. And that includes, frankly, folks who don't have developmental disabilities, but might have other disabilities or healthcare challenges. We don't turn away anybody. We try to work with anybody we can. We reached out to legislators, local officials, local organizations, really trying to get to all corners, if you will, of New Jersey. But I can tell you, it is extremely rare that someone contacts us from any of the cities, from Newark, from Elizabeth, from Patterson, from Camden, from Trenton, from Jersey City, and name the city. I have a feeling that for some reason that there are a lot of folks with developmental disabilities that are aging out in the system, particularly in our cities, and they're not being kept in the system, if you will. They're not being brought into the system of care as adults. The second reason, though, so that's the anecdotal reason. The other reason that we fear it is just looking at the numbers. And one of the things we put in our most recent annual report to the governor, which is on our website, our 2020 annual report, is if you just look at the numbers of the folks that are in the children's system of care with intellectual developmental disabilities, that's really up to age 21, if you will. And that's about 14,000. And you look at, I think, the folks that are in early intervention, which is Department of Health, 0 up to 3. I forget, I don't have the numbers offhand. I think it was about 12, 13,000. If you look at the number of folks that are in DVRS, the Department of Labor, I think it's about 14,000 with disabilities. If you look at the Department of Education's numbers, though, and they're on their website, pre-K through 12, I think there were about 245,000 students that had some type of disability. Now, not all of them are going to be developmental disability. Not all of them are going to require or want services beyond age 21, but it's 245,000 in that system. If you go to DDD, 21 and above, there's only about 25,000. So for some reason, there's a huge drop off. And my fear, our fear in our office is it's during this transition period that we're missing folks, that they're just falling off the grid, they're falling off the system. And so we've really tried to begin exploring with organizations like the New Jersey Council on Developmental Disabilities and others, and within the government, are we missing these folks? Why are we missing folks? Who are we missing? And what do we need to do to do better outreach to them? So that's something that haunts us on a regular basis. So going forward, in terms of solutions, there are a couple of things that we think that we should be doing. One of them, I think Commissioner Bachter mentioned it earlier, is something that DDD is looking at, is allowing folks before 21, at age 18, 19, 20, to enter the DDD system, to transition into the adult system a little earlier. We think that's a great move. We spoke about that in our annual report, and I know that's something that they're pushing forward with, and I hope that happens. I think even more importantly, I think what would be great for families in transition, all families in transition, is if the state assigned a case manager, presumably somebody like a support coordinator, which is the case manager for the adult system, to any student who has an IEP by the time they turn 18, regardless of zip code, regardless of where they live, regardless of, just assign a case manager, a resource that the individual, the student, the family can reach out to over the next few years to answer a whole bunch of questions, again, about legal status, about finances, about Medicaid, Social Security, about getting into DDD, about getting in, employment. Somebody who can be that resource. Again, I know some families have something like that, on their school district level, but I also know a lot of families don't have that. And I think that would be a great equalizer, something that would really make sure that we are transitioning our students, our young folks into the adult world in a thoughtful way, in an effective way, in a way that really sort of, addresses, all of the many challenges that individual and families face. So again, we deal with folks in the office, oftentimes they're in great, stress. There's oftentimes in crisis. And we do our best to serve them. And I think and there as anybody who's been working in this field, or any family member I'm sure knows, there's 1,000,001 issues that we need to deal with. But I think there's a way we can and should address this transition issue. We do have the resources in New Jersey. You heard about it from the commissioner and others. We have a lot of good people, a lot of good programs. We just need to make sure that they're accessible to the people that need them most. The people know, what exists and know how to access them. And I think by providing some kind of case management during those transition years, I think would be a way to do it. Again, I hope we can take some questions. I think there's a couple in the Q&A, but I really encourage any of you, who have not yet contacted our office to please do so. No issues, questions too small or too big. We'll work with you to the best we can to help make sure that you and your loved ones get the services and supports that you not only need, but that you deserve. So with that, I'm gonna take a look at the Q&A. I think that's how we're going to do this. And I'm going to see if there's any questions for me. I'll just read this one is from Lori Michael, who I've worked with in the past. That's right. Glad to see you, Lori. Glad you're here. One's from Brittany Tovar. There seems to be an overwhelming amount of programs, divisions, departments for families and people with severe disabilities to navigate, especially given eligibility requirements. What's great is hearing that some programs talk to each other, CSOC and EDD. Have there been any talks to combine all programs under one umbrella? So it's an excellent question. I mean, again, I really believe, and this is something we talk about, I think, in each of our annual reports, that the complexity of the system, Brittany, is one of the greatest barriers to people accessing the services and supports they need and deserve. If we could simplify it, one of the things I've suggested in my reports is, sort of like we do in the private sector, nonprofits do this too, is, some term zero-based budgeting, basically like starting with a blank piece of paper, because we always get caught up in what exists and what doesn't exist. Take a blank piece of paper and sort of look at the state and say, what are we trying to do? Who are we trying to serve? How do we think we should be organized to serve them? And then find a way, in the most simple way possible, to deliver services and supports to the people that need them. A single point of entry is something we've talked about in the past. Because these are lifelong disabilities, why can't it be that if they're in the early intervention years, once you're in the system, you're in the system? And so information can get added and updated throughout, but you don't have to keep filling out new applications and new forms and new justifications. You don't have to keep, reaffirming on an annual basis that your child has a developmental disability, which is, again, by definition, a lifelong disability. So there's got to be different ways to do it. I will tell you, one of the things I'm really glad is in the governor's office, we've started to look at disability holistically. And under the leadership of the governor's policy director, we've started this sort of interagency sort of effort across multiple agencies, making sure that everybody knows what everyone else is doing on disability, trying to build some bridges where they need to be built, knocking down some silos, and trying to do the work we can do in a more collaborative fashion. So I think that work is underway right now, and I'm really excited about it. And I think it's very promising. But to your point, Brittany, there's a lot more we need to do. We need to simplify this more. And then I see you have another question. What groups, if any, are advocating for entitlements to adults with severe disabilities? Youth, it seems that that people with severe disabilities always need help. The families can't provide on their own and left to fend for themselves. There are a lot of groups, and we can talk offline, Brittany, more about it, so I can understand more specifically what you're looking for. But there are a lot of groups doing it. But you're absolutely right. One of the things we find, and probably not surprising, those with the most significant needs, either severe challenging behaviors and or significant medical complexities, are the ones not being well served in many cases by the system. Granted, none of this is easy. But one of the things, we've been looking at in our office, and we work with different groups of parents on both sets of those issues, are trying to find ways that we can, serve those communities better. There's so much more room for improvement, but there are a lot of folks in government, but a lot of groups also, Brittany, that are working towards that end. Thank you for the anonymous compliment. Thank you for sharing your personal ID. Thanks again for that. Sandra has a question. Say that cycle you mentioned, youth transition and adults still vary, their challenges with them. We sometimes forget that they also become parents themselves who can have their own kids. Absolutely. And if parents never got or fully get the service and supports they themselves have gotten, parenting those same needs for our children, like off the grid, through the cracks. The more I learn about what is available for my kid, the more I realize how much I didn't gain in a sense. Yeah. Yeah, there's, again, there's so much here, but there's so much more we need to do. One of the best quotes, from a family member I heard early on, it wasn't original, but it was well stated, is, we don't know what we don't know. And, information is so powerful, and trying to make it more accessible to people. So you do know, so you can, as a parent, better, help, provide for your child, and then your child can sort of carry that forward. I know, one of the things we've done in our office is we're in the process of building a website. We're trying to make it sort of a one-stop shop, if you will. It's definitely a work in progress, but we wanted to start getting it up early so we could start getting feedback. So I would encourage any of you to go on our website. If you get the website address, I'll get it for you. But we're trying to make it easier, and trying to make sure, and trying to point people in the right direction, because there is so much to know. And the more we know, the better off our children will be, the better off we'll be, and so forth. Is there a member available to households who can sit down and handhold through a process aside from the CMO? Yeah, I mean, that's one of the functions our office has done. Again, I'm the first ombudsman, so the next ombudsman might do this job differently. But one of the things, we've done since the beginning is, pre-pandemic, and then, increasingly over the last few months, is, we will go and sit down with you. I've sat at many kitchen tables in the last 3.5 years, and visited many Starbucks and diners throughout New Jersey. We will, and we're a resource. We work with families sometimes when their CMOs, not doing what they wanted to do, or their support coordinators. Oftentimes we work with great CMOs, and we work alongside them, and same with support coordinators. We're just an added resource, and we can not only share other experiences that families are facing, but we also, because we sort of serve a role sort of as a nexus between, families and individuals on the one hand, and policymakers on the other. We work very closely with legislators, state legislators, both chambers and both parties. We work with colleagues throughout the government. So yeah, we're able to work with you and hold your hand and sit down with you at any time. So definitely reach out, Sandra. Let's see, what else? Would you happen to know the criteria for an additional year of schooling for our children? What is the year cutoff? I think this is the COVID related question. I do have the directive I can send to you if you want to just email me offline. I think it's the next 3 years. I think it was for folks aging out this year, next year, and the year after, but I'd have to get on. I don't know if that's the context of your question. Kathy, yes, Paul, I am all for mentioning having case manager assigned to each student with IEP upon graduation. My son, age 21, is one of those who's not connected, and I'm spending countless hours on websites. It's tough. It's tough, Kathy. And I can tell you, I'm a sibling, as I mentioned earlier, but, as a parent, a step parent of typical children. And that transition is difficult. I mean, under the best circumstances, the transition from childhood to adulthood is difficult. And then, you put in the special needs of many of your children. It just makes it even more confusing and complicated and overwhelming. Again, that's in part why they created our office. But I really do believe that if we did make a case manager available to every student in every school district, everyone would be better served. The child would be better served. The family would be better served. The system would be better served. I just think it would be a win-win. Let's see, Sandra, COVID limited CMO in-person contact, not their fault, just the thing happened, impactful. Michelle Collins, is there a discussion on state happening about requiring school districts to handle transition planning for a few students that become cookie cutter and play students? I don't know. And if you want to send me that question, I can connect you with one of my colleagues in the Department of Education. Again, I can even tell you from my personal experience when I was mayor, working closely with our school district, and a lot of folks try to get it right and try to do the best and try to start that transition process at age 14 and really set, each of the children up, for success going forward. But a lot of districts don't have those resources, and it's just not happening. And so, again, I think we need to find a way to equalize this and make it much easier for the student as well as their parents. All right, I think that's it. I think I've talked about here. So I think I've answered everything. I don't know what time it is now.
It is 2:35.
All right.
Excellent.
So-
Well, thank you so much. We greatly appreciate you being our closing keynote speaker. Thank you, sir.
No, it's great to be here. And again, I appreciate the opportunity. And again, I can't encourage, all of the people participating and anybody who might watch the recording, reach out, to our office, reach out to your CMO, reach out to, we're here to help. There's a lot of people here to help. I know it's overwhelming at times, but definitely reach out, definitely speak up, and we'll see what we can do. So thank you.
Excellent. Thank you very much. We appreciate it. Just so everybody knows, all of the recordings from the webinars, both yesterday and today, will be available on our website. And that website again is www.njyouthtransition.life. We also have the vendor village with available resources for folks to tap into. In addition, every county across the state of New Jersey has a resource net. So you can use that virtual online platform to tap into resources available in your community. Thank you to everybody who participated, all the attendees, all of our panelists. This has been a fantastic experience. And as Paul said in the very beginning, this is the first annual, so we will be back next year. All right, I guess I will close out the session. Thank you, Paul, so much. Take care.